Britain's Queen Elizabeth II has paid tribute to the country's health services and those who are working in the sector in a rare televised address as the country remains in a lockdown for the second week in a bid to bring down the number of coronavirus cases in the country. She warned that there may be more to endure as the death toll from coronavirus rose by 621 in a day, with even higher figures expected in a week. To tell us more about the current state of affairs in the UK, I'm joined by Claudia Churinyana, who is a UK resident and who is also the Vice President of the Burundian community right there. Thank you so much for joining us, Claudia.
Thank you for having us.
So very quickly, tell us, first of all, what is the situation like in the UK where you are right now?
Okay, here in the UK, we are on the third week of the lockdown. We have started today the third week of the lockdown. And as you might have been seeing it on the news, there are so many deaths. Today, we were up to 5,300 deaths because of the coronavirus, because of the COVID-19. But like I said, we are on the third week of the lockdown, and some scientists, some people who are looking into this have said that when they look at the infection rate, they are saying that it's slowing down. So hopefully the death rate is going to stop, of course. But this obviously doesn't mean that the lockdown is going to end. I think we are still in the lockdown, and then I think if we really respect the lockdown, we are going to lower more how many people are going to be affected by the virus, but also the rate of death as well.
Quickly, how do we, do you think rather that people in the UK really understand the importance of lockdown? Because we've been seeing people, resting in the public gardens in London and, in several cities across the UK.
I think to start with, obviously people were reluctant to accept the measures that were put in place. But as days were going by, I think because of the authorities were giving very strong messages, and people and the authorities were also urging people to respect the lockdown. And at the same time, I think we were kept up to date with how the COVID-19 was affecting the population in the UK. I think people kind of realized that it was serious and started respecting lockdown, started staying at home. For those who could work from home, they are working from home. For those who can't, obviously they are going to work, but really respecting the very strict measures and guidance that are in place to make sure that we are getting rid of this COVID-19.
Lastly, we're asking for an advice to the homeland. You are living in the diaspora, but you've seen what is happening across Africa. You've heard about what is happening in Africa in regards to the response to coronavirus. Very quickly, Churinyana, what advice would you give to the people back home in Africa?
I would just say that people need to listen to what the health authorities are telling, or are advising people to do, but also to listen to the guidance of the government as well. Because, if we don't, obviously we are increasing the rate of infection, and, we're not going to get rid of this COVID-19, as quickly as we would like this to be. Because, to be fair, it has affected the whole life, of every single person, in the wide world, I should say. And, I would just say, really, please listen. Listen to what the health authorities are telling you to do. Listen to what the government is asking you to do. And, the quicker we listen to them, and the quicker we are going to eradicate this virus that is really paralyzing everything in the whole wide world.
Claudia Churinyana in the UK, thank you so much for joining us here on Rwanda Television.
You are very welcome. Thank you. You stay safe.
Stay safe too.
Thank you.
Bye-bye. Also joining us from the UK is Emily Pacific Igiraneza. Thank you so much, Emily, for joining us.
Thank you so much for having me.
Fantastic. So how are you coping with the state of emergency in the UK due to coronavirus, of course, the lockdown? What is the situation like?
Well, it's like anything we have never seen before, really. Life has just changed completely, and I can tell you now that, for example, I haven't been out for 2 weeks. If you can just imagine what it means, and obviously it's the entire country. I should mention also that, this is something that took us by surprise, including the government and the leaders. And at the beginning, it was like even the government was not really being serious about it. And we're paying the consequences of this, lack of knowledge that, was required at early stage of this, crisis. So now, even though people have realized that it's more serious than they thought, there are still some consequences that we are suffering just because of the few weeks, that we didn't do better.
I will not keep you for long, but help us understand, you've probably been following how African countries are responding to this pandemic. What advice would you give to the homeland, to the African countries, and how best can people in Africa join in the fight against coronavirus?
Well, to be honest with you, in Africa, there are two different approaches to what is happening. I mean, if you look at a country like yours, Rwanda, they're doing a fantastic job to protect the population. They took it seriously since the very beginning of the crisis. Whereas countries like, mine in Burundi, I'm afraid, they still think that it's not something serious. I heard the authorities today saying that, God is in control, that people should go out and, continue to do what they were doing. There are no social distancing that we see practiced in that country. And there are other African countries where this is really a little bit neglected, where there are other countries that, you see things are taken seriously. What I can say is that, this, if it happens to Africa, we will not afford to really do what these Western countries have done. You're talking about billions of money that have been, injected into economy and the social health services to make sure that people can cope with this. A country like yours or mine will not afford to inject that money. So we need to be serious to use what we can to really try to protect as many people as we can.
Emily Pacific Igiraneza, thank you so much for your time and for joining us here on Rwanda Television.
My pleasure.
Have a good night and stay safe.